Good morning, welcome into the dentist today. How are you doing? I think you're just in for a checkup today, am I correct on that? Good, 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 good. How have you been? Any problems with your teeth that I should know about? No. Wonderful. Now, let me just have a look. I'm just going to get myself ready. I remember last time we did a little clean on your teeth. Do you think we could do that again today? Brilliant. I was hoping that you had the time, because I think there's nothing better than having a good checkup and a little clean up to be sure all is well with our gums. Gum care is indeed the most vital. Without gum care, there's no teeth. And you don't want to have no teeth, do you? I didn't think so. So, I'll just have a little look inside, if that's all right. I've got a couple of tools here. Let me just find the tools I'm looking for. There we are. All right. Just a moment. I nearly forgot. I always keep them on me. There they are. Now, let me just get these. Wonderful gloves in place for you. Right. Push the ends out, make sure we've got everything well and truly in place for you. There you are. Okay, if you don't mind, you're going to feel my light coming in. I just want you to lean back a little. Just lean back, you'll just see a very bright light coming over the top. So let's see if we can just change that a moment. There we are. That's a much better setting. I can see right inside of your mouth like that. Right, okay. Let's get in there, shall we? Would you mind laying back a bit more for me? Just get comfortable in the chair, just ease yourself in. Brilliant. All right, well I'm just going to come in to begin with, just doing a very gentle check around the gum line. Just hear me in there. That's it. Don't wiggle around too much, please. It makes it a little bit difficult. And these are quite sharp instruments. You wouldn't want those harming you, would you? It's going over the top. 1 second. Yes, I'm probably going to have to lay you back down in the chair. You're a bit wiggly today, aren't you? I don't remember this last time. Are you a bit anxious? You mustn't be anxious when you have me as your dentist. Don't be so silly. I think I might have to change the angle very slightly. I did just notice a couple of things there. Do you remember Henry? Henry, the tooth model. I just wanted to point out, I noticed a very small, little tiny hole appearing here in the bottom right quadrant. You can just see, it's just there. That's where we've got it. And also, a little bit inside the gums, around here and up at the top there. I'm not sure you're brushing properly, so we're just going to go through your brushing technique, and I think here what I'd like to do is possibly put a little touch of resin in today, just to make sure that we can stop any more damage occurring. But before we do that, I think it's quite important we might have to take a little x-ray, just to be sure that there's no damage in there, nothing's already slipped past me. That's fine. No, that's absolutely fine. Alright, what you can do you mind? I'm just going to take your head slightly. That's it. Just going to push you back a little. Oh, that's so much better. Alright, just going to take this. I'll be popping it onto the inside of your gum, and if you don't mind, could you just bite down for me? Alright, we're just going to feel it. It's coming in on the left hand side. You'll just see me just popping it in And if you wouldn't mind, could you clamp down nice and tight? Lovely. If you can just hold that there. Now, so if you could sort the lights out, please. All right, you'll just see a little flash. Try not to look directly at it. There you are. All right, that's side one done. Let's take that out. Thank you very much. Let's take that one for me. Thank you. All right, let's go in on the other side. Pop our little X-ray in. All right. Coming in on the next side. If you can just clamp down on that for me. Can you bite down? Lovely. And hold that nice and tight together. Good job. Remember, as I said, you'll just see a small light, and that's it. All done. Fabulous job. Let's take that out. Thank you, Ness. You can just get those up on the computer for me. Right. All right. Well, let's have a look. We'll see, and we'll just check that there's no additional damage in there. Okay. In the meantime, can we have a look at how you're washing? All right. We also have Hufflepuff here. He's very useful at times. So, with our brush, I can just show you. Take the cleaner off the top. Now, I have a suspicion you're just rubbing backwards and forwards, and that's just not good enough, I'm afraid. Sort of up and down motion. This is not doing anything. I want you in on the sides of the gums with a lovely circular motion, making sure that we're really touching the gum line. Possible 90-degree angle inside, again cleaning into the gums as well. And this little area here, you're collecting a little bit of plaque in there, so turning your brush for me on an inward spiral, up and down please, up and down. Again, around the top teeth, the same please. If you can take your brush, going into the gum line as well, making sure a good circular motion. Toothbrush at a 90-degree angle, up and down, give it a really good scrub. That's lovely. And how long are you doing this for? Well, you say 2 minutes. I might be erring on 1 minute, considering what I've seen. So I definitely want your brushing improved. How does that sound? You could, well, listen, I'm happy for you to use your manual toothbrush. You can also get a lovely electric toothbrush like this one here. I'll take that hood off again. You'll see a nice shaping on the bristles. You see that? Yeah, lovely shaping on the bristles. So that gives you a good clean, and you've got longer and shorter, so it's really getting into those gums. That would be really helpful. All right, let me just take a look, please, at the... That's right. I just need to check that there's no additional damage that's happened. Okay, give me a moment. Right. Yeah, okay. All right, perfect. No, not a problem. Okay, I am going to need to just pop a little bit of resin in. You're very lucky today. There is no further damage. So, keep up that good work, but make sure we get it really nice, all right? Okay. I probably would like to come in and just descale a little bit. You have got a little bit of it, and as I said, on the inside, here, roof of the mouth and base, you're getting a little plaque build up. So I am going to come in and just do a little bit of scaling on that, all right? It looks a bit stubborn for the manual, so are you going to be okay with me getting right inside? Good. Lovely. Well, I'm going to come into here and we'll just, can I just lean you back a little? That's great positioning, just as you are. And coming in now, open nice and wide. Oh, you'll see that I'm just going to scrape away. Oh, got some stubborn bits there. And there we are. All right. How are you doing? Are you okay? All right, well, don't worry. I'm just going to do the top now, okay? Going to lay you back again. Are you ready? Leaning back. Lovely job. I'm coming in over the top. That's it. I'm just going to work on the top there a bit. I know, it's a bit uncomfortable. Doing a great job though. You can spit in a moment. Do you need to spit now? Alright, bring you back again. Can you just spit into the little bowl next to you? That's it, just spit into the little bowl next to you. Good job, lovely. Alright then, let's get you back again. Just coming in again for that last cleaning. You're nearly done. I know it's a little bit stubborn around here. That's why I need you to start cleaning a little bit more vigorously, okay? None of this just swilling out with a bit of mouthwash. Actual work. Alright, that looks good. That looks great. Let me just go in and take another look. Alright, now you'll just, it's okay, you'll just, that's it, that's it. Oh, you are doing a good job. Bear with me a moment. Just need to come in here. Can I just, that's it, just pop your teeth there. Stay very still. That's it. Oh, I know it's hard. Open your mouth nice and wide. Lovely job. Just going in on the gum a little bit. You're doing spectacularly well. Keep breathing for me. Keep breathing. That's it. Just gonna sit on each one. A little check on the insides as well. This is just a bit stubborn, so can you just hold your mouth very still? That's it, nice and wide. Let's get the gums. Wonderful job. Wonderful, wonderful. Let's bring you back in here, shall we? There we are. Let's have you here. Right, let's have a look at you now. How are you doing? Good. I'm very pleased. Now, what I will do, you might have a bit of debris in this. I'm just going to squirt a little air through. Don't mind me. I'm just going to a little bottle. All right, so this will come in and you'll feel, that's it, on the top. Lovely. Down the sides. Beautiful. Just see this point. It's going to go just into the tips of your teeth. And again. Lovely. One more down here. Around the sides. Beautiful. One more on this side, please. There's just a little bit of debris just sitting there. Oh, that's it. Got it right out. Well, of course, I'm very versed in this. I'm very used to having my patients come in and need a little additional tender care. Now, I'm just going to swap my glasses over. Yes, do you have that resin ready? Lovely. Let's pop these on for this. All right. So, just going to, you just pop a bit of resin on there for me. All right, lovely. Okay, so you'll first of all feel me just gently pulling away at any debris that's there. Then I'm going to place in the resin and you'll feel a purple light just warming that area. You can just make sure your mouth is kept wide open the entire time. Wonderful. Are you ready? All right, I'm just going to come in. I'm just going to feel my tweezers very slightly, just pulling away there. That's it. All right, mouth nice and open. Let's make sure we've got that in exactly the right position. There. Okay, can you keep yourself nice and still? Close your eyes for me. And we're just going to hold that purple light right there until we're finished. Keep still, please. Purple light's coming right in. Oh, nearly there. A few more seconds and we're done. There we are. Let's take a little look in there, shall we? And have a look at how we're doing now. Just going to bring my bright light in again, okay? All right, here it comes. Just see my bright light and you'll just hear me just having a little dig around in your mouth. That's it. Just want to go in on the other side. Have a little feel around with those gums. Amazing. That's all right. Just on the other side. I just need to get my fingers in there. Just keep keep taking a big deep breath for me. Really good job. Just gonna need to, could you just open your mouth a bit wider? That's it. Just want to get round there. Then that side. Right, I'm quite satisfied with that job. Your gums look lovely and clean now. If you can taste a small amount of blood, don't worry yourself with that. Honestly, that's fine. Right, let's have a little look. I think we're all done here for today. And I'd like to thank you so much for coming in and genuinely being such a lovely patient. It's a pleasure to work with you. Yes, I'm sorry, it sounds like you've got to go back out in that storm. Doesn't sound the best, does it? Anyway, I'll see you in approximately 6 months. How does that sound? Wonderful. Well, I'm very pleased. And you look after those beautiful teeth of yours for me. All right then. Happy listening, my darling. Hello there. I just wanted to let you know that I actually have 3 channels now. So they'll all be down in the description, and I would love for you to perhaps like, comment, or even subscribe. I'm just a baby channel, and I would absolutely adore it if you wouldn't mind subscribing. It would help my channel so much. So I just like to say thank you so much, and happy listening, my darlings.